Good morning. My name is Verita Bell, and I'm the Student Success Specialist at Metro Campus. And I want to thank you for joining us in one of our Success Week sessions. Today, we have Katie Bradford presenting on the Transfer Center and Robert Madison with some information about our health careers. And I will turn it over to Katie, and we'll get this show on the road.
Great. Thanks so much. Thanks for being here today to join us to learn more about health careers at Tri-C and transfer as well. We're going to kind of work backwards today. We're going to start by talking about transfer and bachelor's degrees, and then work our way into some really great information from Bob about our health careers program. So let's go ahead and get started. My name is Katie Brayford. I work for the Transfer Center at Tri-C. So we help students who want to go on and earn a bachelor's degree after their Tri-C graduation. So we'll kind of talk a little bit about what that means and what opportunities there are specifically for you as a health career student to go on and earn a bachelor's degree. And we'll kind of talk about how your health careers degree can help you do that. So let's dive right in. So this is our Transfer Center staff. We have myself, we have Jamie Zeller and Melissa Swafford. We're in the process of expanding this group as well. So be on the lookout for some more Transfer Center staff soon. So what can we help you do? Basically, we help students explore different transfer pathways and partnerships. We can help you do research on schools, programs, even transfer scholarships that might be a good fit for you. Help you actually connect with those four-year schools through things like external advising, which that's an opportunity to have an advising appointment with an advisor from another school that you're interested in transferring to. We can help you with the application process, just kind of general assistance, and then we also offer events and special programming throughout the year. So really anything involved with the process of transfer, we're happy to help. And we are offering appointments both virtually and on campus right now. So if you are interested to meet with us, I'll share some contact information at the end of the presentation. All right, so what are some things to think about with transfer right off the bat? So a Tri-C degree can help you go on and be successful in so many different ways. Transfer is just one of those ways. As we'll hear in a little bit, we have some great programs here that can get you directly into careers. But if you are thinking of going on to get a bachelor's degree, it's really important that you let your counselor know, your Tri-C counselor, so that when you guys are making your academic plan, you can kind of take that into consideration and make sure that you're on the right track to get to that bachelor's degree. So number two, it's really important to connect with the Transfer Center, my office, early on. Even if you're kind of sort of thinking about a bachelor's degree, even if you're not sure yet, let us know. We can talk as early as your first semester and just really talk through, what your plans might be and how to help you get on the right path. Tri-C has some great transfer partnerships, which I'm going to talk about more in just a moment. But we have a link on the slide here if you wanted to check those out in more detail. So Tri-C offers associate degrees that are actually designed for transfer. Those would be the Associate of Arts and Associate of Science degree. So we also offer applied degrees. That would be Associate of Applied Business and Associate of Applied Science. For those degrees specifically, you really want to look at partnership opportunities that will help you have a seamless transfer into a bachelor's degree program for those majors. And that's kind of what we'll talk about in a couple of slides here. So we also are lucky to live in the state of Ohio, where there are some really great statewide transfer agreements that can really help you leverage your Tri-C credits as you move on to your next school. So I mentioned partnerships. What exactly does that mean? We have lots of different types of partnerships. Each one is unique. Basically, what it means is that we've gotten together with a four-year school and created some sort of agreement that gives you benefits transferring there as a Tri-C student. So the basic idea is that it's supposed to help kind of streamline your transfer process, maybe save you some time and money, ideally. We have over 30 different transfer partner schools, so this is just a sampling of them that we have on the slide. We also have a few special partnerships called dual admission with select schools. This actually allows you to be admitted to Tri-C and the other school, the partner school, at the same time, which is kind of a cool way to get started. And then statewide transfer agreements, lots of opportunities here. I want to talk specifically about Ohio Guaranteed Transfer Pathways. These are something that just came out over the last year or so. And basically it shows you how you can complete an associate degree at Tri-C and then transfer that into any public college or university in Ohio. So towards your bachelor's degree. So those are really helpful. And I encourage you to check out our partnerships website. If you just go to tri-c.edu/transfer, there's a button there that can take you to the site as well. So take a look at those, and like I said before, definitely reach out if you wanted to talk in more detail about any of them or need some additional explanation. So our biggest partner school is Cleveland State University. That's where many of our students go. Tri-C credits are transferable all over the country, really. We have students go everywhere, but because they're our neighbor, a lot of students go to CSU, and it's a great school. So we just came out with a new partnership called the Future Vikings program. And this is actually sort of like a big umbrella that'll go over all of our existing partnerships with Cleveland State. So you might hear about other CSU partnerships or names of things like DegreeLink or the Nursing Continuum. That's all going to fall under Future Vikings. So if you're a student that knows that you want to go to CSU, join Future Vikings program, and then we'll get you on the right path to take advantage of some of these great partnerships that we have with them. So if you just email Future Vikings at tri-c.edu, we'll get you started in the program and get you on the path to CSU. All right, so let's talk about health careers specifically for just a moment here. I mentioned before that we have some great partnerships that can help you really leverage your Associate of Applied Science degree at Tri-C. There's a lot going on this slide. I just wanted to kind of represent the full range of opportunities that we have. I'm not going to read them all, but I do want to point out a few things specifically. So listed in bold, there are several programs that are called things like health sciences, public health, allied health, and those are with CSU, Kent State, Western Governors University, and Youngstown State. So these are partnership programs that actually help you leverage your health science degree from Tri-C, your Associate of Applied Science, and move it into a bachelor's degree in a more of sort of a general health field. So if you're a student that knows that you want to go on to get a bachelor's degree, this actually allows you to use all the credits from your Tri-C degree and move those right into your bachelor's degree program, which is fabulous because that could really save you a lot of time and money. So they all have kind of different names for the programs, but they're all sort of a similar idea with allied health, health sciences, that sort of thing. With Kent State, with the public health, they have some other specializations that you can go into with that one as well. You'll also see that we have quite a few partnerships for our exercise science students to be able to use that associate degree from Tri-C. Also for our human services students, Associate of Applied Science and Human Services, lots of great pathways there into things like social work, sociology, substance abuse counseling, etc. So again, this is just sort of a sampling to show you all the different opportunities that you can go into with an Associate of Applied Science degree from Tri-C. But if you're interested in a school that's not listed here or just sort of want to explore other opportunities, you're definitely not limited to just our partnership schools. We can help you kind of research any area that you might want to go into. Oh, and I do want to mention too that some of, especially like the Allied Health from Youngstown and the Health Service Coordination from Western Governors are available 100% online. So if you like that online learning environment, after you get your Associate of Applied Science from Tri-C, you could potentially move into one of these online bachelor's degree programs. So if you want to learn more or talk in more detail, I welcome you to reach out. I have our website here. It's tri-c.edu/campus transfer centers. We have a little screenshot of it there. On that page, you'll find a button to schedule an appointment, and you'll also find our contact information. So my email and phone number are there, as well as for our other campuses as well. So again, my name is Katie Brayford. I encourage you to reach out, and I'm going to pass it over to Bob Madison.
Thank you, Katie.
You're welcome. Let me make you the presenter here. All right.
All right, and I am going, let me know if you could see my screen that says Health Career Programs.
Yes, looks good.
Yep, looks great.
Right. Katie, thank you very much. I think that's a good prelude into some of the subject matter that I'm going to cover today. I want to thank you for stopping in and allowing us to share some of your time with us. We realize that there is a lot of competition for time out there, and we feel that this is valuable information, and we're just happy that you could make it. My name is Bob Madison, and I am the college-wide Health Career Programs Recruitment Specialist. So what I do for a living is I meet with students and I try to make good matches between bright young minds and our over 30 different health career programs that we offer. We offer programs in associate degree programs, which are 2-year, and that's the vast majority of our programs as far as health careers. But we also do offer certificate programs, which can be as short as 16 weeks. So if you're used to a semester system, that's 1 semester. We also have 1-year certificates of proficiency. And really, it does matter as far as the amount of time that it would take to more or less train a person in an individual area. And that's what's going to determine whether it's 16 weeks, 1 year, or a 2-year associate's degree. We offer, or we basically break up our programs into 3 general areas. We have diagnostic care, where you're basically probably going to be involved with a healthcare team in trying to help a doctor or help the healthcare team come to some conclusions about what may be going right with the patient or what may be going wrong. A lot of it has to do with imaging and scanning, and a large portion of our programs, I'm going to talk a little bit about them in a minute, do reside at our Western campus. Direct patient care, as it might sound, you can expect to fully be working with either patients or clients on a day-to-day basis. Not all of our programs are hospital-based or doctor-based, medical-based, human-wise. We do have programs like veterinary technology, which deal with animals over at our Western campus. And we have a human services program where not necessarily patients that we work with, but like I said, clients or people from the community who may need assistance in getting matched with services that are available either at the federal level, state level, local level. So we have a human services program, and that really is not a medical area. Support care is, you're going to find yourself in the background, more or less in the background, doing things that are very, very important in the world of healthcare, but you may not be on the front lines. You may be doing things that maybe a lot of people don't realize, all the things that go on in a hospital that make things work. And a lot of our programs do train people for these areas. I'm going to go over some of these areas as we go forward. At this point in time, there is a separate application for all of our programs. We are going to be moving to a process that's going to make it a little bit easier for you, that is going to basically move you from getting information about areas that you're interested in to helping you take what are called prerequisites. And these are courses or items that you need to complete in order to be able to get into the program and start taking program courses. Usually it's a semester's worth of courses. Some programs are a little bit more intense. And there are some general courses like English 1010, which is a prerequisite for all of our programs. But all of our programs have them, and all of our programs are a little bit different as far as what they require. We'll talk a little bit about that as we go forward. I mentioned our diagnostic care programs. These 3 programs on the page right now are all at our Western campus. Diagnostic medical sonography is very interesting because it involves sending sound waves into the body. So there's something that looks sort of like a little mouse, and it is connected to a very high-priced machine. And what happens is sonar or sound waves is being shot through the skin, through bones in some cases, and it bounces off the thing that needs to be imaged. And it'll create an image up on a screen in living color, moving, sort of like a movie. It's very, very fascinating. And based on the results of these tests, a sonographer or ultrasound technician who does these tests can help a medical team find out if there are things like blockage in arteries, or we have a specific area within sonography called the cardiac option. So all the cardiac option students do is take sonograms on the heart. So, if a patient has had a heart attack or is having issues with valves within the heart, a sonogram may be the test that is performed. This program is a 2-year associate's degree, and it's over at our Western campus. All of our diagnostic care programs tend to be a little bit more high science programs. So if you enjoy science, if you enjoy state-of-the-art technology and things that are coming out on a day-to-day basis, the diagnostic care programs may be for you. In some of our programs, the science will get as high as physics. There's chemistry and much biology that is involved. Radiography is another scanning or imaging area where if you've been to a doctor to get an x-ray, that's basically what our radiography program is going to train you to do. However, that is just a small piece to what can be done with x-ray and the different types of tests. Much of the training involves safety and making sure that not only do you know how to be a good radiographer, a state-of-the-art technician, but also what do you need to do to make yourself safe and to make the patient safe, to ensure this. Mammography is a piece to the radiography program involving women's health and breast imaging for looking for things like breast cancer. You need to be certified, licensed as a radiographer in order to get into our mammography program. ElectroneuroDiagnostic, right down the hallway from the programs we just talked about, nuclear medicine. These two programs are, again, involve imaging. ElectroneuroDiagnostic technology, it's a real long word and a hard word to say for some people when they first look at it. Basically, if you break that word down, it's electro, which means electrodes or electricity. Neuro, which is connected with the brain or the nervous system. And diagnostic, which is, again, we talk about helping diagnose issues within the body, things that may be going right or wrong. So ElectroneuroDiagnostics put together is we're looking at issues with the central nervous system and learning how to diagnose healthy brain waves that are healthy when a patient is at rest or if they're agitated. So ElectroneuroDiagnostics, they'll put electrodes on the scalp and they will bring in the form of waves. They're called brain waves. And there are, you're going to learn in this program how to determine healthy brain waves or things that are pretty normal. Connected into the ElectroneuroDiagnostic 2-year program is a concentration in polysomnography. This is sleep study. And again, this involves, like, if somebody is having a hard time sleeping at night, they may come to a sleep clinic. They may get electrodes put on their scalp. They may have blood pressure pads put on their arms, all kinds of things. And then the doctor or the END, which they're called, is going to say, okay, now go to sleep. Now you have all these contraptions connected to you. Basically, what those folks are trying to determine what's going on when you sleep. Are you having really, really bad nightmares? And if so, those brain waves are going to change. And that could help create a diagnosis that the medical team would be able to help a patient who is having sleep problems. Nuclear medicine, fascinating. One of 2 schools, I believe, in the state of Ohio, where our second-year students are able to work actually with nuclear pharmaceuticals. Basically, you are injecting radioactive isotopes into the body. And these medications have tags, and they will go to certain spots on the body that will be imaged, and they will illuminate on the screen, again, things like cancer. They can determine whether a patient has had a heart attack or not. There's 1,000,001 different things that you can do with this type of technology, but it is state of the art. And again, all of these areas are really highly um, high tech, but they're also based in you need to be safe, especially with things like nuclear pharmaceuticals. You have to know what you're doing. Our programs, for all of our programs, we offer what is called professional accreditation. Professional accreditation is simply the seal of approval from the individual accrediting bodies that look at these programs. So there's an accrediting body for sonography nationally. We invite them onto our campus and we say, tell us what we're not doing right. Go through every nook and cranny, check our curriculum, what our graduates are doing, how many people are in the classroom, what is the equipment that we're using look like compared to what it should be. Tell us where we're going wrong so we can fix it and make things right, or the best they can be. We are professionally accredited in every area that it is available. That just simply means that somebody going through a program knows that they're getting the latest, greatest, best training for areas like the Cleveland Clinic that will hire our people, university hospitals, Metro, any hospital. They fully expect our people to hit the ground running. So our professional accreditation is going to pretty much forecast that. Because in order to get into the program, you need to do the prereqs. In order to get out of the program, you need to get through the program, and the expectations of the accrediting body, and they're all there. You have an orientation meeting in the beginning, and they let you know what the expectations are. And then again, you go forward. You move forward semester by semester. And when you get out, you carry the reputation of a professionally accredited program with you. And you learn how to sell, not just yourself in an interview, but the program that you came from. So in all of these areas, they're professionally accredited. Medical laboratory technology is offered at our Metro campus. It is, if you've ever thought about being like just a general scientist, science is very interesting to you and you like to do experiments. Medical lab tech is simply that. It is doing experiments or tests on body fluids, where a doctor will order up blood tests perhaps, and they'll order up very specific tests that need to be done. Going through this program, you learn what the tests are, you know how to conduct them, you learn how to work with this $1 million equipment, fluid separators and fluid freezers. There's just so many different things that you learn how to do in order to do these tests. This is a support care actually it's diagnostic, but you're in the background. So it kind of quasi moves into that support care area as well. But medical lab tech is very important in helping that healthcare team come to a diagnosis. Because, if you have something going on in your blood and there's indicators in your blood, the MLT is going to be able to determine that in the results of the lab tests that get turned back. Support care programs in the background. We have a cancer registrar program, health information management technology, health unit coordinator, medical billing specialist. These programs are all housed out of our HIMT unit at Metro campus. The health information management is the 2-year degree. Cancer registrar is a post-degree program where you get an associate's degree in a health science and a healthcare field, and then you can apply for the cancer registrar. Health unit coordinator is simply a certificate, a short-term certificate where you learn how to basically run an area of a hospital or a medical facility. So people who have been in the field of healthcare and maybe wanting to slow things down, but still maintain active involvement in, working in the healthcare field, may look at health unit coordinator because it can take everything that all your experiences, and put them into play in this new position in running an area, making sure that everything is fully staffed, that the people from that serve meals do that on time, that we have enough nurses scheduled, that doctors are making rounds at certain times. This is all scheduled through the health unit coordinator. Medical billing specialist also in this department is kind of an outside position. This deals more with the billing side of things. So you may work in a hospital. Typically, a medical billing specialist may work at home, and they can work for a hospital, they can work for an insurance company, or they may work for like somebody that is in between these two entities to sort of do work for both of them in making sure that the patients get billed properly for services that are done. There's coding involved. Everything that you do in a hospital, whether it's walk in the door and stop at the pharmacy, or if you have a blood test drawn, done, anything you do in a hospital, there's a code for. And then that code is used in billing, it's used in medical charts, and you learn a lot about that through the medical billing specialist. It is a short-term certificate, so it is a way to get kind of quickly involved in putting some money in your pocket if that is a goal of yours. It's also a good stepping stone if you want to jump back in and get something a little bit more medical involved. Patient Navigator is out of our medical assisting unit, and it is a 1-year certificate of proficiency. Basically, it again is going to be one of those taking somebody who knows a lot about a hospital and allowing that person to help patients navigate what is sometimes a very, very complicated scenario. People who have multiple things going wrong, they have multiple issues, multiple doctors appointments. A patient navigator will help that patient put all of it together, make sense of it, and make the best of the situation. Maybe schedule it, trying to get doctor's appointments on the same day, or making sure you know where to park, or just maybe utilizing test results in one office, for another office's needs. But it's something new. It's one of our newer programs, and it's more in a public relations type of job where you're taking knowledge about a hospital and medicine and applying it to actually helping somebody who is not familiar with any of this. Laboratory phlebotomy. If you've ever been to, and usually if I'm standing in front of a group of people, usually high school students giving a presentation, I'll ask some people, I'll say, do anybody know what a phlebotomist is? And a lot of people don't. And I'll say, well, for high school kids, I'll say, a vampire is a phlebotomist. And they'll be like, no. Phlebotomy is the drawing of blood. The drawing of blood. And if you've ever been to a bad phlebotomist, somebody who doesn't do it well, you truly, truly appreciate the skills of somebody who knows what they're doing. We teach people who know what they're doing. They find the vein. They know how to calm the patient. They may distract you from what's going on while they're doing it. This program is a one semester program, but with the prerequisites that are needed, typically it comes out to 1 year, where you come in, you do your prerequisites, and then you apply to the program and you get in. That is part of our MLT program, so it's housed and directed by the same person as our MLT program director. Surgical technology and sterile processing are operated out of our Surg Tech unit at Metro Campus. Phlebotomy is out of our Metro Campus as well. Sterile processing is making sure that everything is sterile when either surgery is taking place or other areas where, basically hospitals need to be sterile as much as possible. And I think COVID has brought to light just the importance of having everything clean and safe for patients' protections and the healthcare team's protection. But sterile processing makes sure that all of the units that are used are sterilized, all of the equipment, whether it be test tubes or whatever else is used, maybe in a surgery, scalpels or clamps, things that aren't thrown away, that are reused, need to be sterilized. and they go into these gigantic autoclave machines that are sterilized. They sterilize the equipment. They're like gigantic dishwashers. But basically, the distribution portion of sterile processing is surgery doesn't necessarily just happen in the surgery center. It can happen in the burn unit. It can happen in the children's area of the hospital. It can happen in the cancer center. Surgeries take place all over. So that means that sterile equipment needs to be distributed, both the sterile equipment and then the equipment that has been used, picked up and taken back so that it can be cleaned and sterilized. So that's the distribution portion. That is a 1-year certificate of proficiency. Ophthalmic medical assisting is located at our Metro campus, and this is a person who does medical assisting, but for an eye doctor. So you're going to learn how to assist an eye doctor doing the eye tests, things like putting eye drops in when you, the cataract tests. If you've ever been to an eye doctor to get glasses, they run you through the procedure of getting a prescription, for what the correct eyewear is. You're going to be the person who is the right-hand person for this professional, for this doctor. And it is a 1-semester program, probably 2 if you have you're going to do prereqs, so you're going to get the prereqs done and then go into the program. But it's exciting because you're dealing with the eye. If you wear glasses, you're going to learn a lot about your own eye health. You become very popular at Thanksgiving because everybody is going to come to you for issues with their glasses, issues with their eyes, and it's fun to be popular sometimes. Our pharmacy technology program offered over at our Eastern campus prepares a student for the licensing exam to become a licensed pharmacy tech. And right now there is a great need for licensed pharmacy tech people. They're the people who work, if you go to wherever your pharmacy is, Walgreens or Marks or wherever your pharmacy is, the people behind the counter are either going to be pharmacists or pharmacy techs. Typically, there may be pharmacy assistants who do like very small amounts of work, but the pharmacy techs are trained. There is a licensing exam, and our program is preparing you for that so that you can start with a higher level salary. Right now, I understand that there are signing bonuses being given. So if you take a job at a pharmacist, in order, you sign a contract with that pharmacy, they may give you $2,000 to $5,000 on top of what your salary is. There is a need for them, and we offer that program over at our Eastern campus. You get involved with real life practicums right away, so you're going to learn on the job and doing things that that you've learned in the classroom, and assisting people who have already gone through the program. We also have a mock pharmacy where you're going to get additional practice and additional exposure to what a pharm tech does. Let's see, direct patient care. These programs are all offered out of our Metro campus. Dental hygiene is oral health. It is a 2-year program. It's very intensive. It is a high science program like those programs at West. It is at our Metro campus. The prerequisites are demanding. I don't want to scare anybody away from going into a program like this, because one person's really difficult is another person's really, I love it and it's easy for me. So if I say that the prerequisites are difficult, that's based on what I find difficult. So I try not to say that. I try to say they're challenging. The prerequisites are challenging. But it does prepare a student to hit the ground running as a dental hygienist who cleans teeth, who does oral exams, x-rays. And we have a clinic at Metro campus right down the hallway from where I'm at, where they do teeth cleaning. They do the x-rays with people from out in the community who come in and make appointments with our folks that are in their second year of the program. It is a 2-year Associate of Applied Science degree program. So yeah, it's a great program. There is a high demand for it, and it's a challenging program. Dietetic technology, if you are interested in nutrition, maybe there's someone in your family, or maybe you yourself have certain dietary needs because of some health issues you may have. A dietetic tech is going to work with patients either in a hospital or a clinic setting to help them put food in their pantry or in their refrigerator that is going to be what they need to sustain their body. If they have high blood pressure, or maybe they're a cancer patient, or maybe they have arthritis. Every ailment, every type of illness has nutrients that are going to be good for, to bolster health in those areas, and also food that you probably want to stay away from. So dietetic techs work with patients in helping craft menus and helping put, like I said, good food that is useful for things that may help them benefit in getting better. So that's a 2-year Associate of Applied Science degree. General nutrition is a certificate. So that is just going to deal with the nutrition side of things, not so much with the menu aspect, but learning about nutrition. And it is a short-term certificate where you can get out. A lot of people use this as an add-on. So if they are involved with something else already, or they're going to be maybe a physical therapist or a nurse, they may come back and get a certificate in general nutrition to add to their knowledge base, to add to their prowess as a professional. So that is available. Medical assisting, it's one of our larger programs. I love it because you can do a 1-year, and at the end of that 1-year certificate of proficiency, you can jump out into the world and get a job. You can also continue on for an additional year if you wish and get an Associate of Applied Science degree. It's called a stackable certificate. If you do that and you do the 2-year route, you're coming out with a certificate in medical assisting. You're also getting the phlebotomy component. So you're going to get certified in phlebotomy. Then you're also going to have the 2-year Associate of Applied Science degree in medical assisting. So you're getting 3 credentials, and this may be something that gets you a job in a very, very competitive market. I mean, you're going to probably be able to get a job if you interview decently, but maybe this might get you the job that you really, really want. It is adding more things to your knowledge base, more things that you can offer a doctor's office in doing. And if you've been to a doctor, hopefully, not too often, but everybody's been to a doctor. Usually it's the person who meets you, Mr. Madison, come on back. They take you to the room, they weigh you. They may ask you for any updates to your medical records. And you're also going to be assisting then with any tests that a doctor does. I know that I had an ear infection one time, and I actually had to get one of my ears cleaned out. And it was a medical assistant who did it. The doctor is going to be more or less, concerned with higher levels of stuff. The medical assistant can do things that are at that level. It's not going to be a boring job, and because things change, and every day is going to be something different. We have different varieties of day-night offerings as far as medical assisting, as well as medical assisting at Metro and West campuses. We have a part-time option for that as well. So very, very popular program because there's a great need for medical assistants out there. OTA, Occupational Therapy, and PTA on the next page are involved with rehabilitation. Occupational therapy is dealing a lot with the psychological aspects of rehabilitation and training. A person who has a stroke and it may affect a certain side of their body and they're not able to utilize, let's say, the left side of their body because they've had a stroke. Well, somebody who does things with their left hand has to relearn how to do things with their right hand. or if you've been involved with a car accident and you go through physical therapy, which is the physical rehabilitation of a body part, training on if your knee was hurt and you had to have knee replacement, or you had to have all kinds of work done on your legs, just learning how to walk again is something that an OTA. So there's a lot of one-on-one, a lot of people who are interested in teaching go into occupational therapy assisting. This is a 2-year program, as is our physical therapist assisting program. Both really, really great programs. One of the things we have at Metro Campus is another clinic where we have people from the outside world come in and take appointments for basic things that are done by a PTA or an OTA. And Cleveland State actually works with us. They have an OT program and a PT program, which is a doctorate and master's program. They will come in and work with our assistant students. So you get a lot of hands-on work right away. Optical technology, that's dealing with the creation of eyewear. I mentioned it through ophthalmic. With the degree, you can pick up the ophthalmic portion of it as well as part of the 2-year degree. But optical technology is learning how to make these and learning what looks good on a face. And I know when I go to a lens crafter or any place that sells eyewear and I want to pick out a pair of glasses, I need help because I'm no fashionista and I don't know what looks good on my face. So you're going to, if you're a little bit into fashion, a little bit into science, this is going to be a great, you're good with people, a great 2-year program that is going to teach you everything you need to know to be an expert in that area. We actually have another clinic that our students, it's a student-run dispensary where prescriptions are brought in, and then our second-year program students will help people who come in get the right eyewear. And we do it for low cost and free in some cases for people in need. Massage therapy over at Eastern Campus, it is what it is. There is therapeutics through massage. They do a wonderful job. It may be something that is ongoing in rehabilitation, but it is. It's an accredited program, and you can do your own thing as far as set up your own shop afterward, or you can join. I mean, hospitals will have massage therapists, depending on what the ailment is. But there's a whole bunch of different options, starting from a short-term certificate, a 1-year certificate, a 2-year associate's degree, a post-degree certificate, depending on what you want to do and how you want to do it. We tell students to meet with the program directors to figure out if they're interested in that, what they can do. I'm going to go through the rest of these kind of quick so we can get to some of the other things about the application process. I mentioned PTA, Sport and Exercise Studies at our Eastern Campus. If you are a frustrated high school athlete and wanted to go pro in something, I always tell students, not everybody can be a pro quarterback, but everybody can come in and become a sport and exercise studies specialist. We have people who work in the private sector, people like companies that have gyms or health facilities to keep their employees healthy. We have people running those who graduated from our program. You can work for a college or university in their athletic department. High schools or school systems will hire sport and exercise studies to do the organizing of leagues and hiring of referees, athletic directors. Sport and exercise studies is kind of a great thing that is not going to funnel you into one specific job. With the variety of courses that are offered and the different concentration areas, fitness specialist is one of them. You can do a lot of different things you can build your own career based on how you want to craft the courses and how you want to come out and the concentration areas that we have. Respiratory care, breathing, anything that has to do with breathing. So during the age of COVID, a lot of respiratory care therapists were brought into play. It wasn't just nurses, but they deal with anything from the common cold, which may affect, your lungs and breathing, all the way to end stages, lung cancer and emphysema, and the different therapies that are involved with helping people breathe better, pneumonia. There are so many different therapies. I know that there is something that they use it's a vibrating vest. You put this vest on, they plug it in, they turn it on, and it vibrates. And it basically vibrates your torso and your lung area so that it is shaking things in your lungs that shouldn't be there, that are causing you distress in breathing. That is one of the therapies that can be prescribed, and respiratory care therapist is then going to work with the patient. That's just one example. But it's all about breathing and the lungs. They also deal with breathing during operations and making sure that the equipment, they learn how to deal with the equipment that is used in working close with an anesthesiologist and making sure the patient is breathing properly. Vet tech, I mentioned working with animals. And vet tech it's a 2-year, highly demanding program. It is not because you like dogs or cats. It is because you like science and you want to apply that to making well as many animals as you can. You do all kinds of things like sonograms, you do suturing, you do medicine administration, where you're going to administer medications to a pet. You may be involved with putting a pet down that may be in the pet's best interest, the animal's best interest, to keep from suffering. There isn't anything else they can do for the pet. So being involved with putting the animal down. This takes a certain type of personality, but it also takes passion, and if you have it, a passion to help animals. But it's also high science, so you got to know, like X-ray. They teach you how to do X-rays on animals. Like sonograms, things like that. So it's all about that. That is offered over at our Western campus. It's a 2-year Associate of Applied Science degree. Programs that aren't in our Health Careers Division, nursing, our program, we have a 2-year nursing degree. We also have EMT program, that EMS fire. EMT is, this picture here where you go to a scene of an accident and you are going to sustain a patient and get them hopefully from point A to point B, which would be the hospital. You learn all kinds of different life-saving techniques. You can take this as far as a 2-year associate's degree. And then you can also go for the EMS fire, which includes paramedic. Most firehouses are going to require EMT basic, which is it is a certificate. It's going to require the paramedic certificate as well as the fire academy. And we offer that through the EMS fire all in one. It's a 2-year associate's degree. Now, this you can find on our website at tridc.edu/health careers. And it is a flow chart that takes you from not being at Tri-C to fully being in one of our programs. And all the different steps that you go through, exploring if you're undecided. Once you've made a decision, what you're going to be doing. You're going to be working with academic counselors to put together an academic plan to complete those prerequisites. You're also going to, if there are any observation hours that are necessary as part of the prerequisites, you can get them done during this time. Once you complete your prerequisites, you then are going to apply to the program. Now, again, when we move to our new process, it's going to be a lot more streamlined. We're going to ask you to do some different things rather than apply. We're going to ask you to let us know that you're interested. And then what we're going to do is we're going to keep in touch with you through the process. And then we're going to let you know, hey, it's time for you to request that your credentials, your courses get reviewed so that you can get into the program. This process is not going to change, as some of the wording will change, but this basically is it. Getting you through, onboarded into the program. You can take a look at this. You can make a copy of this, print it off from our website. Resources, I mentioned health, tri-c.edu/health careers. All of the Tri-C websites are going to begin with this beginning portion, tri-c.edu. And then there's going to be a / and then either a word or a series of words that will connect you with the page that you're looking for. For health careers, it's easy. No spaces, the word health careers, one word with an S at the end. That gets you to this page. As far as things to look for on this page as you go through and you're thinking about programs, let's say you pick physical therapy assisting. And so physical therapy assisting is tri-c.edu/PTA. Real easy. It gets you to this page. You plug that into your browser, you hit enter, and this is what comes up. Now, there are things on all of our pages in health careers are going to look very, very similar. My opinion says that there are two really, really important things for you to look for in initially and getting involved with the health career program, and also as you work through your prerequisites. Number one, look for the word packet. It may have the word information in front of it. It may have the word application in front of it. It may have the word student in front of it. I can't seem to get the program directors to get on the same page on naming this darn thing, but the word packet does not change. It typically is in the right-hand corner of the page. If you click on that, that is a document put together by the program director, and it has everything, soup to nuts, beginning to end, that you could possibly want to know about the program, getting into the program, what the prerequisites are, a little bit more fleshed out, salaries, as you become a professional, what are the expectations for the program? It's like a almanac of the stuff you're going to want to know. So look for the word packet. The other thing is prerequisites. You're going to want to know what the courses you are and the things, the prerequisites, GPAs that you're going to need to get into the program, to start the program. So prerequisites typically is going to tell you that. The other word is admission requirements. One or two of our programs call it that. But prerequisites, look for that, click on it. And I have here an example of the prerequisites for physical therapy assisting. It shows you that these 4 courses up here you need to complete. The grade point average in the prerequisites that you need to have coming out of taking these courses. And then like eligibility for a math course or higher. 40 hours of documented observation volunteer time, and then some specific information. So if you've took courses 15 years ago, some of the programs have time limits as far as how old an age of credit you can use. So this information will be in here. Pay close attention to what I call the fine print or the nitty gritty, because you want to make sure that you're following all the rules and understand all of the expectations as far as prerequisites go. Now, I just covered a heck of a lot of information. I could talk all day and all night, I think, about all of our programs, about this process, our changing process. We recommend heavily, I recommend that you, if you are seriously thinking about a health career program and maybe you have some questions, contact with me. I work best with email, but I also take phone calls. Emails, I can answer you at 11 or 12 o'clock at night. I'm never going to call you back at 12 o'clock at night, but I may send an email at that time. But we could set up an appointment, either a WebEx or Zoom appointment, or we can do a telephone, or I like in person because I can show you some things online. I am located at Metro Campus in the Health Careers building, the Health Careers Enrollment Center, and I really like what I do. And I really feel good when a student walks out of my office feeling better about their situation, knowing a lot more about where they're at and where they're going. So I really do. If you can make an appointment with me, do so. This is going to make things probably a little bit easier for you as you go through the process. I think at this time, I want to open it up if there are any questions. I don't know if we have people in the chat who have questions. So much was talked about. There's got to be a question.
Yeah, right now there aren't any questions in the chat.
Okay, let me stop sharing. How do I stop? There's something I can do. Let's see here. Stop sharing. All right. Um, if that, I mean, there's no questions or anything.
No, there are no questions. We do have one attendee, but I'm sure if they have some questions for you, they definitely know how to get in touch with you.
Can I take two? I want to take one more minute, and
Sure.
I want to talk about something really quick about what something Katie was talking about with transfer students.
Cool.
Some students may come to me and ask, "How do I get into medical school?" There's a lot of different ways you can get into medical school. You can go the traditional route, which is go to a four-year university, major in biology, and then sweat it out trying to get into a medical school. You can also get an Associate of Science at Tri-C, transfer to a four-year college, and get a degree that is going to be looked upon by a medical school as being worthy of what they're looking for and the grade point average in the courses. One of the things that I like is getting involved with one of our programs, maybe radiologic technology, radiography, maybe OTA, maybe any of our programs that feed into a hospital. Going to work for UH or the Cleveland Clinic or any other hospital, most of the hospitals out there have employee benefits where they will allow you to go back to school and take a few courses here and there to work towards a bachelor's degree or work towards improving your situation, as long as it applies to what you're doing at the hospital. And they will pay for it. They'll give you a certain amount of money that you can utilize. And I like the fact that you can have a hospital maybe pay for you to get your bachelor's degree. So if you want to go to medical school, it's going to take you a little bit longer because you're going to go part-time. You may take a course in the evening or on the weekend, or you're going to take some online courses, um, while you work full-time during the day. But you're not going into massive debt. And when you get to the point 6, 7 years later where you have your bachelor's degree, the Cleveland Clinic or UH has paid for most of it, if not all of it, you're at a point where you can make some decisions. You may want to change your mind from going to medical school to becoming a physician assistant. That requires a bachelor's degree. You may say, gee, I think I could run this place better than it's being run. You may want to go for an MBA in hospital administration. That requires a bachelor's degree. What you also have then is you have this experience in the hospital at a world-class facility. You have an associate of applied science in a very narrowly focused area. All things that are going to bring this together for you. So, and the other thing is you may say, I love what I'm doing. I don't want to change. It's been 6, 7 years. I got my bachelor's degree. I want to take that, put it in my back pocket. I can maybe use it down the road, but right now I'm happy. I'm getting paid well. I like what I'm doing. I live in a cool place. Everything is working out for me. You don't have to then jump into what you initially thought you were going to do 6 or 5 years earlier, but you have it. So that's something I like to bring to light because some people think that there's only one way to get to a medical school or a dental school or law school, graduate school. There's a lot of different post-baccalaureate programs that are out there that, hey, let the hospital help you. And then I don't, Katie, if you have anything to say in regards to that, but I like to bring that up because who knows, you may be interested in that.
I would just say I echo everything that you just said. I think that's a really great message, and just to know that there is more than one way um, to go after that goal. And like you said, plans might even change over time, and maybe that'll end up being, they'll end up sticking with the career that they're in already. So I think it's a great opportunity.
Great. I think it's 11:59 on my clock. I think we want to probably end this session, but we want to thank everybody for, if you view this down the road as a repeat, thank you for stopping in and checking us out. Hopefully, get in contact with the Transfer Center or with myself in Health Careers. We want to help you. So it's not a burden. We want to help you. It's what we do. And we'll, unless Katie has something else, we'll let you go for today.
That's all. Thanks, everyone.
Thank you.
Thank you, everybody.